Common in newborn boys, but also really, really important for their long-term health. I'm talking about the incompletely descended testis. So, over the next 5 minutes, we're going to break down what it is, why it happens, and most importantly, how it's treated.
So, here's our game plan. We'll start by solving what I like to call the missing testes mystery. Then we're going to follow its amazing journey during development to see exactly where things can get a little off track. After that, we'll get into the detective work of diagnosis and why it's so critical. We'll look at the fix, the path to correction, and then we'll wrap it all up with the key things you absolutely need to remember.
All right, let's kick things off. What are we actually talking about when we say undescended testes? And is this something rare or pretty common? Let's find out. Okay, so get this. About 4% of all full-term baby boys are born with at least one undescended testis. And for premature babies, that number skyrockets to somewhere between 20 and 30%. So yeah, this is a really common thing that pediatricians deal with all the time. So the fancy medical term for this is cryptorchidism. And really all that means is that the testis got stuck somewhere on its way down and didn't make it all the way into the scrotum. Now, it's super important not to confuse this with a retractile testis. That's a totally different thing. It's a normal testis that just happens to move up and down, but it can be easily guided right back where it belongs. And what's kind of interesting is that it's not an even split. It happens more often on the right side, about half the time actually. The left side gets affected in about 30% of cases, and then for the last 20%, it happens on both sides. So to really get why this happens, we have to go back to the beginning. We need to look at this incredible, almost epic journey that the testes takes before a baby is even born.
All right, picture this. Way back in the second month of pregnancy, the testis starts its life way up high in the abdomen. And then, over the next 7 months, it slowly makes its way down, passing through this little tunnel called the inguinal canal. And if everything goes according to plan, it lands right in the scrotum just in time for birth.
So, what could possibly go wrong on this big trip? Well, a few things can throw a wrench in the works, and there's a pretty handy acronym to remember them. SAD. The S stands for a short spermatic cord. That's like its lifeline, and if it's too short, it just can't reach. A is for adhesions, which is basically internal scar tissue that can block the path, and D is for defective hormonal stimulation, meaning the chemical GPS signals that guide the journey aren't working right.
Okay, so we know what can cause it. But how do doctors figure this out, and why is it so critical to catch it early?
Well, one of the very first things a doctor has to do is figure out if we're dealing with a truly undescended testis or that retractile one we mentioned earlier. A big clue is the scrotum itself. See, with a retractile testis, the scrotum usually looks normal and well developed. But with a true undescended one, that side of the scrotum might look a bit smaller or just underdeveloped. Well, what happens if the doctor can't actually feel the testis during an exam? Well, that's when the real medical detective work begins. They might try imaging, like an ultrasound or an MRI, and those can sometimes help. But honestly, they're not always super clear. The real gold standard for finding a hidden testis is a minimally invasive surgery called a diagnostic laparoscopy. That's how they can go in and know for sure. And this is why early diagnosis is so crucial, because if you leave an undescended testis untreated, it can lead to some really serious problems later on. There's another great acronym for this one. TESTIS. T is for trauma, because it's not its naturally protected spot. E is for epididymoarchitis, that's inflammation. S is for sterility, which means fertility issues. The next T is for torsion, a very painful twisting. I is for an indirect hernia. And the final S is for seminoma, a type of testicular cancer. And this is a big one. The risk is 5 to 10 times higher, probably because that higher temperature inside the body just isn't great for the cells over the long run. Okay, that all sounds pretty scary, I know. But here's the really good news. This is absolutely a correctable problem. So let's talk about the solution. So, why do we treat it? Well, there are a few key goals. First and foremost, we want to give that testis the best possible chance for future fertility. We also want to bring it down where it can be easily checked, which dramatically lowers the risk of missing a potential cancer later on. And of course, we want to prevent those other nasty complications like hernias and torsion. When it comes to treatment, timing is everything. It's really, really critical. A lot of these undescended testes will actually finish the journey on their own in the first 3 months or so. But if it's still not down by the 6-month mark, that's the signal that it's time to talk about surgery. And the sweet spot, the ideal time for that procedure, is between 6 and 12 months old. That window gives the best odds for normal function down the line. The surgery itself is called an orchidopexy, and you can basically think of it in 4 steps. First, the surgeon carefully frees up that spermatic cord. Then, step 2 is making sure there's enough length for it to reach the scrotum without any tension. Step 3, they create a little pouch down in the scrotum to tuck the testes into so it stays put. And finally, if there's a hernia there, which is common, they go ahead and repair that at the same time.
All right, we've covered a lot of ground, so let's boil it all down. What are the absolute must-know points here?
Okay, here are your 4 key takeaways. Number 1, most of the time, the issue resolves itself by 3 months, so we watch and wait. Number 2, if it's not down by 6 months, that's your cue. It's time for referral to a specialist. Number 3, getting that surgery done early is so important for future fertility and lowering that cancer risk. And finally, number 4, if you can't feel the testis at all, laparoscopy is the gold standard for both finding it and fixing it. So when you step back and look at it, this is a common condition, but it's also a highly treatable one. The whole game comes down to 2 things: early detection and early intervention. And that's exactly why those regular baby checkups are just non-negotiable. It's such a simple thing, but it can literally change the course of someone's future health. Which kind of leaves us with a final thought, doesn't it? With a treatment that's so successful, why does just getting it done on time still one of the biggest challenges for long-term male health? Something to think about. Thanks for joining me.